guys, today we're going to be talking about the elbow and what are some of the common causes of elbow pain and elbow issues as well.
So in elbows, we often more describe it as tennis elbow. So that's pain on the outside, what we call or lateral epicondylitis on the outside, or we have on the medial side of the elbow, which is golfer's elbow. So they're generally going to be issues of tendons attaching right into the bone. So oftentimes, again with tendons, it's too much too soon. We overload the tendon and therefore affect the pain signals in the tendon, what we call the musculotendinous junction at the bone. So one of the etiologies Dr. Brandon will talk about in regards to sport, and then I'll talk about the work ergonomic side of things.
So they have their names of tennis elbow and golfer's elbow for a reason, because it's that continuous one-sided rotation or motion of that elbow. So you actually find different parts depending on your grip as well with a lot of those one-sided sports. So it's just causing extra stress along the tendons and not having that proper positional place for actual motion throughout the elbow as well too. So you start creating extra stress, and then just that repetitive. You go do 100 swings or 100 different racket hits. It's going to start causing a bit of the inflammation and a lot of the pain into those elbows as well.
Absolutely. When you're not used to doing 100 swings, it's going to inflame the tendon. So that's why it's less is more at the beginning, and we train our bodies into our performance so that we're not overloading tendons in the beginning of our performance. So the other side of the coin is obviously work ergonomics, and I remember in the middle of last year when we came out of our first big lockdown, our 6-week lockdown, I had a number of patients present with elbow issues after changing their ergonomics. So moving from laptops at work, big screens at work, and then coming home and changing sitting mechanics, and then changing where their elbows and wrists are. During typing created a lot of tendon issues in the elbow. So that's one thing to be mindful of too, is your work setup, where your shoulders and elbows are. It's really important, and making sure you take those micro breaks throughout the day to make sure you don't overload these tendons. Is there anything else that we've missed?
No, it was always interesting to hear a lot of the different setups people had at home. So I know people were saying that they were putting their computers on their ironing boards as well, to just kind of set something up. So
ironing boards.
Yeah. So what are some of the main symptoms that you notice around it?
Symptoms. So pain, swelling, tenderness, sometimes weakness, lack of grip strength. So we test that in here when you come in for an appointment, if you do. What else do I see?
So not so much with the joint, but a lot of times with the tendons around?
Yeah, definitely. It's going to be driven. This is particularly going to be driven by the tendon pain for sure. This particular etiology, this particular disorder of the elbow. Obviously, as chiropractors, we're going to be looking at how your neck and shoulder and wrist are functioning on top of it, because everything's connected. But main pain is going to be driven by that tendon.
Yeah. Cool. I think we hit most of it. So
awesome.
Perfect. Next time we'll be talking about top tips to help against elbow pain, or golfer's elbow and tennis elbow.
Great.